Our greatest commitment is the one we have to you. Tebo Dental Group.
My name is Dr. Darcey Taylor, and I'm a general dentist with Tebo Dental.
Give us a brief overview of your professional experience, education, and any aspects of your background that you'd like to share.
I've been practicing dentistry for almost 30 years. I went to school at the Medical College of Georgia, which is now the Georgia University, Regis University. I graduated in 1986 and private practice for a little while, but actually did group practice for about the past 20 years.
What attracted you to the company?
I actually interviewed and got along well with everybody that I kind of come in contact with, all the way from the administrative staff all the way to the clinical staff.
What motivates you?
The biggest thing that motivates me is making sure that the patient is confident in what I do, and that they're confident in the fact that they're going to be comfortable in what I do. Because a lot of the fear, of course, comes in the fact that a patient, first thing they're going to ask is it going to hurt? But I take pride in the fact that I make sure that doesn't happen. And once I do that, I find out that the patient is very dedicated to me and the practice, and of course, whatever we recommend or suggest that they do.
In your experience, how has technology changed in the field of dentistry over the years, and what is your impression of technology here at Tebo?
Very efficient. I'm very impressed with the way that it actually allows me to process during the day, meaning like I don't have to spend a lot of time looking for the assistant, wondering whether the patient is in the chair, whether or not they're being processed, whether or not they're being rescheduled for their next appointment. A lot of that was very impressive that I saw with Tebo. And the only thing I can see it is getting better.
What would be some of your goals in the family practices?
I've always been a big stickler about a patient knowing who I am before they know what I can do. So I'll always go into an operatory and I'll sit and I'll talk to the patient, not necessarily about dentistry, but I'll just kind of just make them feel comfortable, just to let them understand who I am and what I actually can offer them.
What are you most passionate about as a doctor?
I really enjoy doing dentistry and all aspects of it, because they'll ask me like, well, what do you like doing best? And I really just don't have one particular thing that I like doing best. I like interacting with the patients. I like doing the procedures that I do. I like the challenges. I like to learn new stuff. I'm constantly in continuing education courses. And always just looking for that extra, just to make myself better. But of course, it translated into making the patient more comfortable, and of course, deliver a product that's going to be that the patient can be proud of, and of course, that I can be proud of.
What has been your impression of Dr. Tebow, from one medical professional to another?
I can see the experience in his mannerism. I can see it in him practicing. And even though I got a lot of experience, I can still see where I can learn a lot from him. Pediatrics has been kind of a thing that I would do, but I didn't do a lot of it. But just in the past week or so, I've learned a lot on procedure-wise, approach-wise, and just different things that he actually has to offer. And I can't see that doing anything but getting more experience in what I want to do, and learning and always trying to improve myself by, of course, the courses, the people I'm around, and of course him being that, I think I can probably, advance on in that particular area pretty quickly.